Hello, my name is Joshua Santos and I attend Kaiser University. My thesis paper is regarding the ethical standards in the healthcare practice industry. My paper has to talk about preventative care actions, integrating with ethical standards, how the relationship between patients and physicians, healthcare providers integrate. The ethical standards in practice is the ethics in healthcare industry to build a relationship between healthcare providers and patients to make sure they have the trust and the honesty between each other, the integrity and accountability of one's diagnosis and explaining the physician or provider explaining everything to the patient. This can also prevent fraud, false claims, neglecting the patient, abandonment of the patient. The thesis is for my paper, the introduction of HEDIS has a significant impact in the ethical standards of medical practice within the healthcare industry, improving the standards of care of healthcare providers providing to patients, and HEDIS measures are making sure that physicians are using preventative care actions to help give guideline to the patient of their diagnosis. Now, HEDIS stands for Health Effectiveness Data Information Sets. We're gonna call it HEDIS for now. The three main points is standard of care, prevention and practice, medical practice, and also documentation. Now, with standard care, HEDIS forces basically the government adopted HEDIS to for physicians or healthcare providers to follow, make sure physicians follow this protocol. So physicians and healthcare providers are needing to make sure that they are assessing the patient correctly. Now, with standard of care, they have assessment forms and making sure they're not overlooking assessments, any overlooking any small little detail. So, with this assessment form, it shows the functional status of the patient, if the patient can properly do daily activities, if the patient is in pain, it has a pain assessment, and also make sure it's about medical review, a medication review. I'm sorry, medication review. It's so significant to have a medication review due to other doctors are prescribing medicine that could interact, and other doctors are not knowing what other physicians are prescribing, such as, for instance, Viagra and also Nitro, which could, if if patients take both of that, it can decrease in the blood pressure and send the patient to the hospital. Now, for preventative care shows that HEDIS is making sure that they're hitting all these measures to prevent things such as breast cancer, such as colorectal screenings, such as testing for it in their blood of LDL cholesterols, making sure it's not getting too elevated to prevent heart attacks in the future, diabetes, making sure that A1C is below 9%, making sure that they are being controlled with their diabetes, or even trying to prevent having diabetes. HEDIS protocols are making sure that doctors are doing all these preventative care measures so the patient does have control of their diagnosis and also try to prevent having those diagnoses. Now, with documentation has the ability for healthcare providers to speak to the health insurers on properly documenting, clearly documenting what the patient has. So this communication tells from the healthcare provider to the health insurer what the patient has, so they can go ahead for that, specifically for that patient, what they are monitored to and what preventative care actions they can take with that. Now, with all this being said, I feel that HEDIS is the future of our practice and of the future for medical practice, and this benefits the ethical standard of physicians and health and patients to communicate better, and we can all have clearly HEDIS is clearly known that HEDIS is the medical practice in the future. Thank you.